Hi, this is Chris Oberg. We're inside the Georgia Dome again. We've just finished our meeting, and I'm with Dr. Les Pollard from Loma Linda University. We're glad you joined us. I know you're here because you're an administrator from Loma Linda. Tell us about that.
Well, my area is the Institute of Community Partnerships, Chris, at Loma Linda University, and I'm here with the delegation from Loma Linda. I'm serving as a delegate to the General Conference session. And I'm here with a number of other colleagues as well, so we have a good representation here, and we're seated in the GC delegation.
I see where you all sit. The Loma Linda tribe sits together. Y'all cluster back there.
Yes, we do.
Yes, you do. I want you to tell us about your assignment specifically with Loma Linda and how it is you're involved with community relations.
Well, I serve as Vice President for Community Partnerships at Loma Linda University, which means that I'm responsible for the interface between the local community and the university and med center initiatives. So all of those come under what we call the Institute for Community Partnerships. That's the institute that kind of oversees how we interface with our community, so that we're doing it in ways that are not only beneficial to our students in terms of service learning activities, but it's also culturally competent, so that the community is enriched and empowered by our interaction, as opposed to being demeaned and even angered by sometimes an inappropriate handling of community resources.
Wow, I like that, culturally competent, that awareness of moving around the community. That means students, that means employees, that means, county departments. It's a broad ministry, an umbrella there. I want you, if you could be specific of the kinds of things that people might get involved with who are students or employees at Loma Linda.
Well, there are a number of very important initiatives that are happening out in the community. Let me just say, first of all, that many are launched from the university side of the organization, and many are launched from the med center side of the organization. Obviously, those that are launched from the university side are more student learning focused. Those that are launched from the med center side have more employee engagement, as we're seeking to improve the social indicators of health in local communities. So let me give you an example of just some of the kinds of programs that are going on. One that we have that's taking place that begins this summer is called the Exodus to College. This is a program in which our university and the students get involved with helping young people in the local community know what opportunities are available in health care. Another program that we do in the community is called, of course, the Social Action Community Health Clinic, called our SACS program. But at SACS, we have a number of students who run a community clinic once a week. And that's wonderful because we get attendings and students out caring for the health conditions of our local communities. So there are a lot of wonderful programs. That's just two of them, and I could go on. From the Med Center, we have about 40 that are in the community. And from the university, we've counted another 25.
Wow. So that's very powerful. Tell us, because you're interested in community connectors, we had a visit earlier in the week from the Surgeon General, and she made some comments about being eager to partner with the Adventist Church, specifically as we are engaged in the community. I wonder if you could reflect on that.
Oh, I appreciated her remarks very much, and so much of what she's describing is what we're already undertaking at Loma Linda University. For instance, in our local San Bernardino community, we have one of the highest infant mortality rates in the state of California. Another area where we are challenged in our local community is around childhood obesity. Yes. Another area in which we're challenged in the local community right around San Bernardino has to do with hypertension. So, from our Med Center side and as a part of our community benefit program, we have identified some of the particular morbidities in the local community that we are attacking through our actual efforts, through actual interventions. And we're right at the point now where we're doing the strategic planning to roll that out. Now, that doesn't mean that other activities are not taking place, because there's health education that's going on continuously in the community. But this is a more focused approach because it's grounded in our community benefit program. Another way that we are trying to intervene, as per the Surgeon General, has to do with how we educate young people for care of themselves and for their health. So one of the big issues now in local communities is how do we build the healthcare pipeline so that there are adequate numbers of healthcare providers in these local communities. And we do that through many of our pipeline-based programs at Loma Linda.
You know, it just strikes me as I listen to you talk that probably the average church member in our conference in Southeastern might be completely unaware of the variety of ways you're connecting, especially Loma Linda,
Yes.
and healthcare opportunities and whole living, holistic living into the community. I'm a little surprised at all the things I've heard from you as well. Did you know that the Surgeon General had a history with the Adventist Church as a young scholar? Were you aware?
No, I wasn't, but I was very pleased to know that. And the former Surgeon General, actually, too, David Satcher. I know a number of Seventh-day Adventists who have worked in his administration. So we have this history of health care and health care for intervention for communities. And now we're beginning to see, I think, with the new movie on the Adventists, etc., I think we're beginning to see the fruition of that. We're beginning to see some of those relationships mature in public life.
Tell me, just as we close this afternoon, how it kind of sits with your soul to be involved in these kinds of initiatives for the church, and specifically in Loma Linda and the surrounding communities. What does it do for Les Pollard?
Oh my goodness, it's indescribable. To know that what we are doing as an institution on behalf of the Seventh-day Adventist Church is making a profound difference in the lives of people. I wish, Chris, we could spend some time collecting the testimonies and sharing those of people whose lives have been touched. We have young people who started when they were children in the Sachs Clinic, who now, because of the intervention of the Sachs Clinic, are now students enrolled at Loma Linda University in the healthcare programs. I mean, that's priceless. And Loma Linda University is a tremendous resource to our church. And I'm grateful for the vision of the founders who saw the intricate connection between health and well-being and spirituality. And so we're trying to live that out at Loma Linda. Everyone is trying to do that in every place. You as a church pastor, we as institutional administrators, others are trying to do it in different ways, but we're all trying to work for the common mission.
That's great. That's great. Thanks so much for your viewpoint. That's another viewpoint for Southeastern California Conference.